So you're almost back to normal, as you said, in Israel. The majority of the population has pretty much been vaccinated now. Why do you think that the rollout has been so successful in the country?
So there are several factors. One, of course, you need to have the provision of enough vaccines, and with Israel secured quite early the vaccines, and this was mainly because of the Ministry of Health negotiating. Israel also had a very good relationship with different vaccine manufacturers, and especially with Pfizer, that it was decided that Israel will become a model for other countries. But then we have also the National Health Insurance Law with 4 non-profit health funds. We have in Israel vaccination by nurses that were easier to deploy from other parts of the healthcare system. And third, we invested quite a lot of energy in fighting fake news. There are lots of initiatives by the Ministry of Health, but also bottom-up initiatives by different communities, by municipalities, adapted and tailored to different cultural sectors. There were some problems with the ultra-Orthodox community and some of the Arab population, but in the last few months, things improved dramatically. We still have about 1 million people, and I'm especially concerned about 250,000 that are above 50 that are still either hesitant or resisting, and we still continue to have a campaign, and again, preparing also for vaccination of children age of 12 and above.
Well, it's certainly been an extraordinary effort. What do you think that other countries, for example, Australia, can learn from Israel's success?
I think the most important factor is to have an integrated system to call all the different stakeholders, including pediatricians, family physicians, and to create a trust in the system, to be very transparent, and also to be flexible enough and to have some of the system being decentralized and adapted to the different localities. You cannot have one size fits all, and especially probably in a country like Australia, where you have different regions, you need to adapt to the existing systems, and of course to have enough workforce. But investing in the social media and fighting fake news, that's something that is also very important, but tailored to the different communities. And trust is probably the most important one, including addressing minorities and other groups that maybe have some history. Any country has its own history of mistrust, and this should be addressed with community leaders.